Hello, everyone, and welcome to Inside Healthcare. We begin with an in-depth look at post-traumatic stress disorder, or PTSD. We've all heard a lot about it, especially with our returning troops from the battlefields. But do you know that there are people everywhere who suffer from PTSD caused by all kinds of trauma, and they may not even realize it? Joining us is an expert on post-traumatic stress disorder to tell us all about it, how to recognize it, if you or a loved one has it, as well as to tell us about one of the most effective treatments available today through the VA Medical Center, and now it's available here in the Twin Cities for anyone in the community with PTSD. Well, we're very pleased to have with us Dr. R. John Sutherland. He's a licensed psychologist with the Healthy's Mental Health and Addiction Services. Thank you for being with us.
Yeah, my pleasure. Happy to be here.
Fascinating topic. Before we get into it, maybe you can tell us a little bit about your background, your fellowship, your training, which is all very unique.
Yeah, I went and received my PhD from the University of Houston in counseling psychology in Houston, Texas, and did my internship at the National Center for PTSD, Pacific Islands. Did my fellowship with Michael E. DeBakey, VA Medical Center, specializing in PTSD and anxiety disorders, and then most recently became a certified national trainer in prolonged exposure for PTSD through the Center and Treatment Study of Anxiety out of Philadelphia. And Dr. Edna Foa certified me.
We're going to talk about this prolonged exposure. Very interesting treatment. But maybe we can talk about first what exactly is post-traumatic stress disorder, and how do you recognize it? What are the signs and symptoms of it?
Yeah, what we know is that most people will have a traumatic event in their lifetime. Most people, however, have a natural recovery. It's the individuals that continue to have symptoms such as intrusive thoughts, nightmares, flashbacks, hyperarousal, avoidance, and a lot of negative cognitions, particularly shame and guilt and self-blame, for more than a month that end up having a diagnosis of PTSD. And what we know is if they continue to have these symptoms longer than a year, they're likely to have it for the rest of their life unless they receive treatment.
And it can really impact their life. I mean, they become almost disabled by it.
Yeah, they avoid places that they used to go to. They avoid people. They don't want to talk about it. And then they start to isolate and have a lot of depression. And a great way to avoid is using substances. And so we see a lot of that with PTSD as well.
And I understand some people may not even know that the symptoms that they're experiencing are related to like a former trauma that they had experienced.
Yeah, I mean, I think that they think that it's just depression, or people will tell them just to get over it and not talk about it, not really work through it, and that just makes the symptoms actually worse.
Wow. So now you've started providing this prolonged exposure treatment at the Healthy's Mental Health and Addiction Services. What is that all about, and how does that work?
So prolonged exposure for PTSD is an evidence-based treatment, so it has a lot of research. It has anywhere between 45 and 55 research studies. It's the most researched treatment in the world for PTSD. And it has about an 80 to an 85% effectiveness rate with a 6% relapse rate after about 5 to 10 years. Typically takes 10 to 12 sessions, and most people have remission of PTSD after they undergo the treatment.
So they're really cured of their condition?
I don't want to say that it's an absolute cure, but it makes their lives a lot better, and they're able to engage in life and feel a lot better and competent about their abilities to do things that they used to do. And family members typically see a huge change in them after they undergo prolonged exposure for PTSD.
Now, like your background in training, it has its, its origin in the VA Medical Center, this prolonged exposure?
There was a huge dissemination project where the VA Medical Center wanted to acquire the most researched evidence-based treatments in the world, and so they disseminated prolonged exposure for PTSD as well as cognitive processing therapy. And by disseminating these two treatments, veterans then were able to receive these evidence-based treatments because, again, it typically only takes 10 to 12 sessions before a person has remission in their symptoms. Not a lot of community-based places
And this will be one of the first here in the
Yeah, we will
upper
be.
Midwest almost?
We will be the first hospital setting with a 90-hour substance use disorder treatment, along with prolonged exposure, being able to receive those treatments at the same time. And so we're really happy to be able to provide this to the community, since we know for a long time our veterans have been able to receive it, but our civilians in the community haven't been able to acquire this treatment as readily as they maybe should have.
Any idea how many people in the community might suffer from post-traumatic stress disorder?
We know that about 3.5% of individuals have a diagnosis of PTSD. So it can come from a variety of different types of traumas, be it rape, sexual assault, direct combat, natural disaster, witnessing a murder. These are all types of traumas that create symptoms of PTSD.
So the treatment, how does it work? Are you revisiting when we're talking prolonged exposure? Basically, what is it?
So the idea here is that with prolonged exposure, most people will try to avoid talking about it, thinking about it, memories. They also avoid getting out in the community. Large crowds, any places with loud noises, they'll avoid that. And by avoiding, what that does is it actually makes the symptoms worse. And so when individuals tell them not to talk about it and just get over it, it actually makes it worse. They start to feel incompetent, they don't feel good about themselves, they have a lot of self-blame. Why couldn't I handle it? Other people would have done this better than what I have. And that actually keeps the symptoms around. And so at prolonged exposure, what we do is we engage them in the memory and we have them revisit it and talk about it so that they can have a new understanding of what actually happened to them. It's kind of like we put it into slow motion. And then what we do is we also have them engage in activities that they avoid, like going to the mall or going around family members. And by doing that, they learn that they're able to do that, and that overall, that they're more competent, they're able to do these things in a way that maybe they thought that they weren't able to.
Do we know from the research why that works? By engaging them in that trauma that caused the initial condition, how does that relieve them of it or get them over it?
Well, what we believe is that there's something that we call an emotional structure. It's made up of fear, it's made up of guilt and shame and cognitions that are maladaptive. And what that means is that they don't feel good about their abilities to do things. And so what we know is that if we actually have them re-engage and get them in it, it causes an extinction or it causes a break in the way that they think about things. It's kind of like the first time you ride a bike, you're really, really fearful of it. But the more you do it, the more confidence you receive, and then you're able to just get on the bike and just do it. You re-engage in life. So in essence, what prolonged exposure does is it creates a recovery, just like a natural recovery for individuals who go through a trauma, but they're able to do it themselves. We help them get into that recovery more.
And once they've gone through this, it doesn't come back again?
Only a 6% relapse rate, according to the literature, between 5 and 10 years, according to some literature that Patty Resick did recently.
As a psychologist, it's got to be rewarding for you to see a patient who's been dealing with this for months, years, and then to suddenly they no longer have this fear and anxiety and this condition.
It's very rewarding. I come from a family where my father was a military veteran, and that's why I initially received my training in the VA medical center system, because I knew that if I could learn this treatment, then I could bring it to the community and help a lot of individuals who have a history of rape and sexual assault to be able to actually have a life again and not isolate and be depressed. And so it's very rewarding for me to see these people get better. And it's very rewarding for our clinicians at St. Joseph's Hospital.
So that's where it's located for our viewers that are watching, the Healthy's Mental Health and Addiction Services Clinic and that?
Yeah, right now we have 30 clinicians who have undergone the workshop for prolonged exposure for PTSD, and they're seeing patients, and many of them are about to be certified. And so, like I said, we'll be the largest hospital setting in Minnesota to be able to offer prolonged exposure for PTSD with our certified clinicians in prolonged exposure.
So if someone's watching us right now, what would you say to them if they might have gone through a trauma that they're still dealing with? What would you say?
What I would say to them is it's okay to talk about it. It's okay to re-engage in life, and that there's treatment out there, and you could live a much better life than what you're living right now. And we have the research and the literature and the clinicians that know how to make your life better. We just need you to not avoid. Come on in and receive the treatment. And for most people, you know, that 80 to 85% of people, they get better. And families really can tell a difference.
You know, it's when you were talking about that re-engagement and that, is it painful for the patients to be going through it?
So initially, sometimes the symptoms will increase, but that's kind of like, it's kind of like we're a surgeon. In the very beginning, a surgeon knows that they have to cut open the wound and it hurts. But the surgeon also knows that the only way to get rid of the infection is opening it up and cleaning it out and then sewing it back up. And so that's what we're doing. And so the symptoms will increase for some individuals, but for most people that's short term, and they get better, and they get better fast because they're able to understand what happened to them in a different way.
Wow. So if someone is interested in contacting you, contacting the clinic, how do they go about doing that?
You know, contact St. Joseph's Hospital. You can inquire about the treatment, and again, we have 30 providers that are in the process of certification, and we're happy to help people get their lives back.
And is it like clinic hours, basically?
Yeah, we're typically there from 8 to 4:30. However, we do have some providers that do prolonged exposure on the weekends and in the evening.
And do they need insurance covers it?
Insurance does cover it. Matter of fact, insurance is very happy with prolonged exposure because it's 10 to 12 sessions. And so some people will end up receiving treatment for 3, 4, 5 years for trauma or PTSD, whereas this is 10 to 12. And so it's an evidence-based practice, and so that it is covered by most insurances.
Anything else our viewers should know about post-traumatic stress disorder, about prolonged exposure treatment, about the Healthy's mental health and addiction services?
Yeah, the thing that I would say is that at Healthy's we have a great group of providers that are ready to help them reclaim their life, and if they are willing to go on that journey with us and let us help them, for most individuals it pays off. Is it painful? Yes, but you have to think about the long-term benefit, and I think that that's why we're here. We're here to help and help you get your life back.
Well, thank you, Dr. R. John Sutherland. Thank you for being with us.
My pleasure.
I'm so used to calling you John Sutherland, so I had to get that R, that initial in there, so apologize about that. It's been wonderful to have you with us. Great information.
Likewise.
Really appreciate it. Thank you.
Thanks for having me here.
Thank you. Still ahead, we're going to tell you about 3 Minnesota hospitals that are now baby-friendly. We'll find out all about it and what it means for you. Stay with us, everyone. Thanks. Thank you.
Mom, can we get some ice cream? Please, Mom, please.
No, we're having dinner soon.
Please.
You don't have to be perfect to be a perfect parent. There are thousands of children in foster care who will take you just as you are.
A diagnosis of breast cancer changes your life forever.
She told me I needed a mastectomy.
I was scared.
Absolutely in shock.
But you need to know that you're not alone. There are teams of medical professionals, support groups, and therapists, and those who can help you plan for life after cancer. Before you undergo surgery for breast cancer, get the facts. Make sure you know your breast reconstruction options. For more information, visit broaddayusa.org.
Welcome back to Inside Healthcare. 3 Health East hospitals, St. John's Hospital in Maplewood, St. Joseph's Hospital in downtown St. Paul, and Woodwinds Health Campus in Woodbury are the very latest hospitals in the country to be designated as baby-friendly. To tell us about the special recognition and what it all means for new parents in the community, we're very pleased to have with us Carol Bussman and Jeanette Schwartz and Linda Johnson from the Health East Maternity Care Centers at Health East Hospital. So thank you for being with us.
Thank you.
So before we begin talking about what is baby-friendly, why don't we talk about just a little bit about what do you do at Health East Hospitals? Jeanette, we'll start with you.
All right. Well, I am the clinical director for the Maternity Care Center at Woodwinds Health Campus. I've been there since Woodwinds opened in 2000, so for 14 years. I'm able to help design programs and practices that we currently implement at Woodwinds.
And seen thousands of babies.
Seen thousands of babies
being born there.
Yes.
Carol?
Yep, I am the clinical nurse specialist for Health East Maternity Care, and I do go between all 3 sites. It's an advanced practice registered nurse role, and I work with planning care for more complex patients, being a resource for nurses and the different physicians and midwives that we have, working at policies and how can we provide the best care for our patients.
And by different physician resources, because a lot of them are in private practice, right? That deliver babies at the hospitals.
Right, but also that our practices at the hospital are evidence-based and good care for our patients.
And Linda?
Hi, I've been with Health East for 27 years, and currently I coordinate patient education and lactation services for our 3 maternity care centers. And what that means is if we have a special need for education that isn't met through traditional means, maybe some of the resources that are available for patients.
Like online childbirth?
Correct. Then I collaboratively create a handout, or we do have our online classes. And then also coordinating lactation services. We have a total of 7 lactation consultants throughout our system, both at the bedside and in an outpatient setting. And so I just coordinate their activities. So.
Well, this is really big news, baby-friendly designation. I don't know if the general public is aware of it, but it's a big deal. Why don't you tell us, jump in wherever you'd like, on, I mean, what does it mean to be baby-friendly?
Well, baby-friendly is an international designation, and it's promoted by the World Health Organization and UNICEF, in that it recognizes hospitals that have incorporated the 10 steps for breastfeeding and infant feeding programs and starting babies out the best way that we can. This is American Academy of Pediatrics has said that if we would incorporate these 10 steps and help moms gain a goal of 90% of our women in the United States to exclusively breastfeed for 6 months, the United States would save over $13 billion a year in healthcare costs. And so to facilitate this, the United States Breastfeeding Baby Friendly Initiative has created a program that would then designate hospitals. It's quite intensive, surveying hospitals to make sure they've put these practices in place. Now, one of the questions that always comes up is, why is it termed baby-friendly? If you're not baby-friendly, are you baby-unfriendly?
Yeah, really. In fact, I had someone say when I mentioned that you just got the designation baby-friendly, they go, I always thought they were baby-friendly.
Yes.
Yeah.
Yes. And so we asked that question to the central office, and they said it's because it's an international designation. The 2 words that could be interpreted and translated easily to all languages are baby and friendly. And so it became baby friendly for that reason. So.
Carol, maybe you can tell us about those 10 steps. That, I mean, it's quite a major step to get from one to the other, actually.
Yeah, there are 10 steps. There's some structure that you put in place with it, and then the processes that you do. So first of all, that you have written policies that are evidence-based, that support best practices for mom and baby. There is a significant investment in nursing staff and in our obstetricians, family medicine, our midwives, and education so that we all have the same consistent message and processes, that we really have opportunity to inform pregnant women prior to their delivering of what are the benefits of exclusive breastfeeding and some of the other infant feeding practices, that we, when babies are born, that we help them initiate breastfeeding within the first hour of birth, that we place babies skin to skin, and
that's not always easy. I mean, because things happen during the delivery and things like that.
That's correct. Yep, but it's having in the mind that mother and babies belong together. They belong together skin to skin. There's so many benefits for both mothers and babies with that. Then also that we help mothers and show them how to feed their infants. If they happen to be formula feeding, we respect that and give them the education they need. If they're breastfeeding, along with that, we have a consistent message of what are best practices to get off to a good start. Other things that we don't provide infants that are breastfeeding formula unless it's medically indicated. We don't give artificial pacifiers or nipples to them. We keep moms and babies together rooming in so that they have a chance to get to know each other. Families can learn their baby's feeding cues, and they feed as the baby cues rather than watching the clock. That we also have support for mothers once she leaves the hospital. We have connections for her. And then lastly, as an organization, we are in alignment with the World Health Organization code in that we pay fair market value for our formula and our supplies, and so we really don't have an obligation because it's a gift to us. It's that we pay for that and we provide best care with that.
Linda, what would be some of those benefits, first of all, of the breastfeeding for the mom and the baby?
Well, benefits are many for the health of the mom and the baby. Some of the research tells us that moms have a reduced risk of developing breast and ovarian cancer if they exclusively breastfeed their infants. They also have a lowered risk of developing type 2 diabetes. Then for the infant, they have less occurrence of ear infections and upper respiratory infections. For the infant too, a less risk of developing type 2 diabetes and maintaining a normal weight over their childhood and into their teen years. So what are the benefits then of having a healthy mom and a healthy baby? We've known from our U.S. government that if we exclusively breastfeed those babies for 6 months, the health benefits translate into about $90 billion of healthcare cost savings because babies and moms are healthier.
Wow, that's incredible. In fact, wasn't it childhood obesity one of the reasons why you first got interested in this?
Yes, that's right. The SHIP grants that were put out by the government in 2010, Washington County Public Health approached Woodwinds campus and asked if we would like to be involved in that project. And we said yes. And one of the goals of theirs was to establish the hospitals in Washington County becoming baby friendly. And so that was the kickstart for Health East, because when Woodwinds was approached, then of course all of Health East was. And the 3 hospitals together said, yes, we'll join this initiative. So yes.
Yeah, I don't know if the general public puts that together, childhood obesity and breastfeeding, that connection. So that's really interesting.
Yes.
What would be some of the other benefits of, I like the idea that you continue the education with the new mom even after they leave the hospital, because I think that could be some of the challenging times. How do you continue to do that?
Well, our outreach nurse calls mothers that are discharged if mother wants, and the physician orders, they can have a home care visit. And then we have support groups, and with La Leche Leak, we definitely refer them to early childhood family education, other parent support groups and classes.
We also have our own outpatient lactation consultants, and they're available by phone for telephone consultations, and they can also have moms seen in our clinic, and we have outpatient lactation at all 3 of our hospitals, Woodwinds, St. John's, and St. Joseph's.
And we have really worked very closely with the Early Childhood Family Education in that they provide a licensed instructor who knows about development and partner that with our lactation consultants. And then it's a free class that they can come to, the mothers can come back to. We know
that's nice.
within the first 2 months of life, a mother really doesn't have enough energy to pick up the phone and register for a class and pay money. And so we know that if we have classes on site, that they know that's hospital, they know the hospital they delivered at, they can come back to that hospital, and it's free and it will be there. So if they decide to stay, I can't come because I'm too tired, that's fine. Or I can come today and that's fine. Well, the class is going to be held no matter what. And it's not really a class, it's more of a group support that helps each other, moms helping each other learn about growing and babies' development and support around feeding practices.
How challenging was it? I mean, what will someone who's delivered before at one of the 3 hospitals, what will they notice this time from when they previously delivered their baby?
I think they'll note consistency in how we provide care to that mother, and that's what our patients have told us, that I'm hearing the same message when a nurse or the physician comes in. They're not told one thing this way and one thing that way. It's consistent best practices. So I think that's one thing that happens. I do know our mothers that have had cesarean births, and they have the immediate skin to skin after birth. They find that very calming in the operating room, and then also once they are in the recovery room and with their care afterwards.
I bet they do, yeah, that would be really important.
Yeah.
And I understand even if someone's had a C-section that the staff, the doctors, everyone makes that effort to get that skin to skin.
Yep, we've worked with anesthesia as well, that they have felt it calming to mothers. You know, they will place the leads in a different place just so that baby can be skin to skin with mother.
Anything else about the importance of that skin to skin?
It helps with newborn regulate their glucose homeostasis. It helps regulate, adaptation to living outside of the mother. It's calming. They hear mother's heartbeat. They begin to have mother's good bacteria placed on them by contact with mother. So that's all good. And one other comment, I think sometimes viewers think, well, I'm not of childbearing age, but I think it's important, whether they're a family member, a grandmother, how can I support new moms having their babies? Things, these are best practices worldwide. How can, encourage her that she's doing a great job, help her in other ways so she is free to feed her baby.
Right, I noticed we were at a family gathering and someone was asking, did the baby take a pacifier? My grandson, who's 5 months old, and he doesn't. So they were surprised by that.
Yeah, so we think that as we have learned in the hospitals, we also want to get to the community that really breastfeeding is the gold standard. We realize that there are families that can't, and we will support that too. But if the community and society recognizes how important this is, then we can start supporting a mom so that when she has some difficulty, she will reach out and find more resources. And that's the other thing, to have more resources in the community, so we continually try to find new ways that we can help support moms so that they can reach their goal of breastfeeding for at least a year, if not longer. And that American Academy of Pediatrics says exclusively breastfed for 6 months and then breastfeeding continuing for up to a year, if not longer. And we know the health benefits are there. We just want the community to know also that it's important.
We have 1 minute left. Final comments, Linda, about baby friendly, about what does this mean for new moms and babies?
Well, I think we've touched on some of the high points. Maybe in summary, I would just want families to be reassured that we do have some evidence-based practices in place in all 3 of our hospitals that will support their feeding choice. We are here to honor and recognize our patients, our mothers' choices. And while I agree with what Jeanette said about breastfeeding being the gold standard, we definitely have the skills to help mothers formula feed their infants safely too.
Carol?
One just quick comment. A lot of women say, why would I not breastfeed? It takes 500 calories a day to do it. So it's the natural recovery from their birth
Get your body back in shape.
That's right.
Quicker, yeah.
Just that we are very excited that the 3 hospitals in Health East have received this designation of baby friendly. It really does establish that we have best practices in place that help infant feeding programs across our 3 hospitals, and that we can help these mothers meet their goals.
And one of the first in the Twin Cities.
And the first organization in
The system.
on the system-wide.
Yeah.
Yes.
Well, it's really been a pleasure to have all 3 of you with us, and awesome news about the baby friendly for all the moms out there. And
Thank you, Jody.
so thank you so much.
Thank you.
Jeanette, Carol, and Linda. Thank you.
Thank you.
And we'd like to thank you for joining us. We'll hope to see you next time on Inside Healthcare. See you then, everyone.
Inside Healthcare. For more information, visit stjohnshospital-mn.org or call 651-326-7800.